You know the feeling, a pounding headache, a sore back, maybe a twisted ankle. We reach for a painkiller almost without thinking about it. But have you ever stopped and wondered what's really going on inside your body when that little pill starts to work? Well, we're going to break down the hidden science behind that everyday relief. It really can feel like magic, can it? You take a pill and maybe 30 minutes later, that throbbing pain just fades away. But it's not magic, it's actually a fascinating biochemical process. And we're going to pull back the curtain on exactly how these drugs pull it off, and in the process, uncover some of their surprising and kind of hidden consequences. So the drugs we're talking about here are called NSAIDs. It's a bit of a mouthful. It stands for non-steroidal anti-inflammatory drugs. But you definitely know them. We're talking about ibuprofen, naproxen, aspirin. They're some of the most common drugs on the entire planet, and they all work in basically the same way. Okay, so to really get this, we're going to follow the story from start to finish. First, we'll look at your body's own alarm system, how it even creates pain in the first place. Then we'll meet the two key enzymes that are right at the center of this whole thing. We'll see how most NSAIDs are kind of like a sledgehammer, which will lead us to some more targeted drugs. And finally, we'll connect all of that to the side effects and figure out who really needs to be careful. All right, so let's start right at the beginning, the moment of injury. What is actually happening on a chemical level that sends that signal to your brain that says, ouch, that hurts? It's actually a pretty simple three-step chain reaction. It all kicks off when a cell gets damaged. The second that happens, it releases an enzyme called phospholipase A2. This enzyme immediately gets to work breaking down the cell's own wall, and that creates this raw material called arachidonic acid. Now, this acid is the key ingredient your body uses to produce something called prostaglandins. And you can think of those as the chemical messengers that literally scream pain to your brain and kickstart the whole fever and inflammation response. But here's the thing. Turning that raw material, the arachidonic acid, into those pain messengers, well, it isn't automatic. It needs a special kind of enzyme to get the job done. And it turns out there are two main versions of this enzyme, and they have totally different jobs. So a great way to think about them is as the housekeeper and the firefighter. And this is where the story gets really interesting. On one hand, you've got COX-1. That's our housekeeper. It's always on, just humming along in the background, doing all this essential maintenance, like protecting your stomach lining, helping your blood clot properly, and keeping good blood flow to your kidneys. Then, on the other hand, you've got COX-2, our firefighter. It's normally just sleeping, totally dormant, but it springs into action the second there's an injury, and it starts pumping out the prostaglandins that cause pain, fever, and inflammation. So one is for daily maintenance, the other is for emergencies. So if the firefighter enzyme, COX-2, is the one causing all the pain, then the goal of a painkiller is pretty obvious, right? Just stop it. But the way most common NSAIDs do this is a little bit like using a giant sledgehammer to turn off a light switch. And here it is, the most crucial point. Drugs like ibuprofen are non-selective. They just can't tell the difference between our two enzymes, so they shut down both of them, the housekeeper and the firefighter. So yeah, they silence the firefighter's pain alarm, but they also shut down all of the housekeeper's essential daily jobs. And that is the central trade-off right there. You get the pain relief you want because you've blocked the firefighter, COX-2. But you also get all the potential side effects because you've blocked the protective housekeeper, COX-1. It's a package deal. And this dual action is the absolute key to understanding why these drugs can sometimes cause problems. But, not all NSAIDs are created equal. Some of them have very specific ways of dealing with this problem, starting with one of the oldest and most famous drugs in history, aspirin. See, aspirin plays by a whole different set of rules. Most NSAIDs, they just block the COX enzymes for a little while, and then they let go. Aspirin, on the other hand, latches on and blocks them permanently. For things like your blood platelets, this is a huge deal. Platelets can't make new enzymes, so once aspirin hits them, their ability to clot is basically gone for their entire lifespan, which is several days. This is exactly why low-dose aspirin is so effective at preventing heart attacks. So this whole non-selective sledgehammer approach got scientists thinking. They asked a really logical question. What if we could design a smarter drug? A drug that could surgically target and block only the COX-2 firefighter that's causing the pain, while leaving our helpful COX-1 housekeeper completely alone to do its job. And they did it. They created a whole new class of drugs called selective COX-2 inhibitors. And the theory worked, at least for the stomach. By leaving that housekeeper enzyme alone, the risk of things like stomach bleeding went way, way down. However, in doing that, they uncovered a new and pretty scary problem. These super-targeted drugs actually increased the risk of heart attacks and strokes. It was like, in solving one problem, they'd accidentally created an even bigger one.
So now that we understand the two enzymes and how different drugs block them, let's connect the dots. Let's look directly at how blocking them leads to that cascade of unintended side effects we've been talking about.
Okay, first step, the most famous side effect, stomach trouble. This is a direct result of shutting down our COX-1 housekeeper. Remember, one of its main jobs is to produce these prostaglandins that create a thick, protective layer of mucus in your stomach. When you turn that process off, your stomach lining is way more vulnerable to its own powerful acid, and that can lead to irritation and in some cases even ulcers. Next up, the kidneys. It turns out prostaglandins are also super important for keeping the main blood vessel that feeds your kidneys nice and wide open. Now, for most healthy people, this isn't a huge deal. But if you're dehydrated or you already have kidney issues, taking an NSAID can cause that vessel to narrow, kind of like pinching a garden hose. It can choke off blood flow and potentially cause some really serious damage. And finally, let's get back to that heart risk. The best way to think about it is like a scale, a delicate balance. Your body has a natural anti-clotting signal, and that comes mainly from our firefighter, COX-2. It also has a pro-clotting signal, and that comes from the housekeeper, COX-1. When you take one of those selective drugs that only blocks the firefighter, you're essentially taking your foot off the anti-clotting brake while leaving the pro-clotting gas pedal pushed down. And that just dangerously tips the balance towards forming clots, which can lead to a heart attack or a stroke. So, given all these potential consequences, it's pretty clear that while NSAIDs are incredibly useful, they aren't for everyone and they're definitely not without risk. So who specifically needs to be the most careful when using them? It is absolutely critical to talk to a doctor before using NSAIDs if any of these things apply to you. People with chronic kidney disease, heart failure, or severe liver disease like cirrhosis are especially vulnerable. Even just being dehydrated puts extra strain on your kidneys, making NSAIDs riskier. And they are generally avoided late in pregnancy because they can actually affect the baby's heart development. So what starts with just a simple pill for a headache ends with this complex story of housekeepers, firefighters, and a really delicate biochemical balance. NSAIDs are, without a doubt, powerful and effective tools. But understanding their dual nature, the fact that their benefits and their biggest risks come from the exact same mechanism, it really changes how you see them. The next time you reach for one, you'll know it's not just blocking pain. It's tipping a very, very delicate balance inside your own body.